I'm Dr. Amit Nabar, Director of Emergency Department and Community Medicine at SL Raheja, a Fortis Associate Hospital. I'll be speaking on incidence or rise of diarrheal diseases during the monsoon. Monsoon provides welcome relief from the unbearable heat. However, every year we see a rise in risks of many host of diseases, especially in the monsoon season, and one of them being diarrheal diseases. Every year we see a rise in the diarrheal diseases as a result of contamination of both food and water. This gastroenteritis or stomach upset or loose motions or diarrheal diseases, as commonly called, can be because of variety of causes. They can be viral in nature, they can be because of bacterial contamination or because of parasitic contamination. The presentation of it is usually of three types. Either a person or patient may present with severe watery diarrhea or may present with a lot of motility related disorder like abdominal pain or cramps. At the same time, he might develop fever, body ache, might start passing blood or mucus in stools. These are the various ways that a patient presents in a case of a diarrhea. Why is there an increase in the diarrheal diseases in monsoon? One is because of increased humidity. This promotes increased growth of bacteria and molds on food and leads to contamination. Poor personal hygiene, lack of proper sanitation habits adds to the challenges. Lastly but not leastly, it's water contamination. If you've noticed, the municipal water may be coming well purified, but our ground tanks many of them are at the ground level, where the rainwater and everything can easily seep in through the doors or through the openings of the tanks, leading to contamination. Then again, there are challenges which are associated with stagnation of water. Now, what are the common symptoms? The patients might present with cramps, with pain in the abdomen. There is an increase in the volume of stools. There is an increase in the frequency of stools. If anyone is having increase in the frequency of stools and more than 3 per minute, which is watery in nature, which is loose in nature, then you can be safely diagnosed to be having a case of diarrhea. And if it's more than 10 stools in one day, you are a case of a severe diarrhea, and whereby you will need to take urgent medical help. You can prevent this thing by drinking safe water. That I would say boiled water, and most of the times avoid outside food as much as possible. Prefer home cooked food. And lastly but not least, whenever you're washing your vegetables you can add a touch of vinegar, or you can use those fruit cleansers or a clean water while you are washing your fruits. When it coming to eating outside food, as much as possible, it is always advisable to avoid eating outside food. But if you are, for some reasons, do not have an option, always eat cooked food. Avoid green leafy vegetables, avoid salads, avoid chutneys. These are the things, or raw vegetables or half-cooked food. Many times the Chinese food that you get is half-cooked, is not completely cooked. Avoid these things if you have no option to home food. Whenever you have got a severe diarrhea, as I mentioned, more than 10 episodes of stools, you are feeling toxic, you are getting dehydrated, that is the time that you need to urgently seek medical help. And what are the doctors going to do? The doctors are going to, one, look at your hydration, correct your fluids, correct your electrolytes, and lastly, start your medicines to control the source. That's either if it's a bacterial, viral, or parasitic infection, whatever it is, we are going to soon start you on a treatment for the same. So without any further delay, whenever you show signs of severe dehydration, signs of past fever, signs of having abdominal pain, it is the time that you seek help to the nearest emergency department. Thank you.